The Department of Veterans Affairs is getting ready to award what's likely to become one of the biggest service contracts in government history, possibly $1 trillion over the next decade. It's the follow-on contract vehicle for the private sector healthcare services VA started paying for under the Mission Act. Officials say it will bring more rigorous management to the department's role as a healthcare payer, but members of Congress have questions and say they were left in the dark about the contract right up until the moment VA issued the RFP last month. Federal News Network's Jared Serbu is here with details.
The massive contract vehicle represents only the second time VA has signed large contracts with health plans to coordinate private sector care for veterans. The first was shortly after the Mission Act was signed in 2018. Those contracts are now expiring, and VA wants to replace them with what it says will be a much more rigorous approach to program management. Richard Topping is VA's Assistant Secretary for Management and Chief Financial Officer.
This program has been unmanaged since its inception, so none of the tools, none of the controls that we are talking about and introducing here have been available for. So VA had no ability to manage this program, to drive quality, to focus on the outcomes for veterans, to focus on cost. We've now got the ability to do that in this contract, so that's number one. Number two, the way we designed this unmanaged program made it very difficult for industry to partner with us. It made it very difficult for community providers to serve our veterans. It made it difficult for our TPAs because it didn't operate like any other payer program, which made it one-off anomalies. That made it difficult to be part of this.
The new contract, called Community Care Network Next Generation, is meant to be different. VA says the department intends to cast a wide net for vendors, creating an indefinite delivery, indefinite quantity contract that doesn't only attract large national health insurers.
We are very much intentionally not limiting the large vendors. The intention and the ability to use the IDIQ is to open this up to competition to non-large vendors, but to those who might bring regional capabilities, regional capacity, that would not be able to operate on a national or semi-national scale. We want those vendors on the vehicle. They will incur a cost to bid and be awarded a spot on the vehicle. But once they do that, the vendors who are on the vehicle with us, large and small, have a seat at the table with VA, with our program management team, to design those next task orders. There are 2 initial task orders in the initial award. Those look a lot like what we have now, large regional. But we are going to immediately partner with the vendors on the vehicle to begin to build the next more regional, more adaptable, more local models in our task orders.
VA plans to use the IDIQ contract for its purchased health care for up to 10 years. The contract includes a 3-year base period, followed by 3 2-year option periods, and a final 1-year option period. During that time, the department plans to use on-ramps and off-ramps to bring new vendors onto the contract and remove ones that aren't meeting performance standards. And contract performance will be overseen and measured by VA program officials who plan to start implementing measures that value quality care over numbers of procedures performed.
VA will implement a comprehensive quality program for community care providers based on nationally recognized measures for the Agency for Healthcare Research and Quality and the Healthcare Effectiveness Data and Information Set. Contractors will track patient safety events, identify veterans at risk of avoidable visits and readmissions through predictive analytics, and while respecting their choice, guide veterans towards higher-performing providers. NextGen will modernize how VA pays its contractors for the care furnished to veterans by implementing value-based payment models. We will begin with episode-based payments for lower extremity joint replacements. As we gain the data and the expertise to manage alternative payments, we will introduce at least 3 additional models over the performance period of the contract to continually improve care. These models will shift payment away from volume and toward outcomes and total cost of care, which aligns contractor incentives with veterans' health and system sustainability. We will introduce utilization management. This includes active management of inpatient admissions, emergency department use, concurrent hospital reviews, high-cost drugs administered in clinical settings. This will reduce unnecessary hospitalizations and inappropriate care while protecting veterans' access to medically necessary services.
But the department faced bipartisan skepticism during a hearing yesterday, partly because VA officials have been slow to detail their plans for the CCN NextGen effort to members of Congress. VA's overseers on the House Veterans Affairs Committee say they found out the details of the contract at the same time vendors did, when the RFP was released a little over a month ago. Mike Bost is the committee's chairman.
I understand the VA finds it unprecedented to hold a hearing on an active contract solicitation. I appreciate the sensitivity of the contract, but it is also unprecedented to avoid Congress's oversight of $1 trillion of spending. My staff and the ranking member's staff have been told that some topics are off limits because of the sensitive nature of the contract and solicitations. We've tried to create a venue in which VA would feel comfortable to speak candidly to our members, but unfortunately, VA failed to assure us of such candor.
Meanwhile, Democrats on the committee also worry that the new contract will serve as a way to further privatize VA health care, pointing out that more than 40% of veterans' care is already delivered by private providers through the existing contracts. Kentucky Congressman Morgan McGarvey worries the contract will lead to large, vertically integrated conglomerates driving veterans into facilities that they control and away from smaller, community-based providers.
I don't trust big insurance companies to take care of anybody. The sole thing that motivates them is profit. It's not people, and it's certainly not our veterans. And you can talk about $1 trillion and $2 trillion, and those are really big numbers that you can paper over in front of this committee. But until we're looking at those contracts and we're looking at those numbers, those are just assurances. And we have the right to be skeptical when we are talking about private insurance companies taking care of people, because right now they don't.
But Topping says the department believes it can avoid problems like the ones McGarvey's worried about through strong oversight and program management.
The vendors, our health plan partners on this, don't make the clinical referral from the direct care system to community care. VA does that. They don't make the referral to the provider. VA determines that. They don't determine eligibility. And so VA drives where and how our veterans receive care. We want to know what we're buying. We want to steer our veterans to the highest quality, lowest cost providers. Again, that's a goal that's not unique to VA. It's new to us, but we're bringing this into this program. We are going to make those determinations. Our vendors, our health plan partners on this don't drive that. VA does. We own our veterans, and we are accountable for their care.
Vendors hoping for a spot on the contract have until March 16th to submit their proposals. Jared Serbu, Federal News Radio, part of the Federal News Network.
You can find Jared's story at federalnewsnetwork.com.